All right, we're back with John Gallucci, President, CEO of jagpt, and also a certified athletic trainer. You got a lot of injuries this week, John. I think it's every week in the NFL. But let's start with my New York Giants and their running back, Devin Singletary. He's dealing with a groin injury that popped up late. And groins are tricky because it could be a couple of days or it could be a couple of weeks.
Well, as you know, the New York Giants have an awesome medical staff, and they're going to take their time and make sure he's ready to go. The biggest thing we know, it's a soft tissue injury, so there's a lot of things that go into it. It's not just about decreased pain. It's flexibility. It's function. Think about the position. A running back, he's got to be able to cut and turn. So they're going to make sure he's ready to go and make sure that he's healthy enough. And as you said, a groin injury, like all soft tissue injuries, can lag. And you don't want this lagging through the season. So it's better to take your time, get it done right, and put him back on the field healthy.
Luckily, we had Tyrone Tracy, the rookie, who showed out in his first start of the year last weekend. But another soft tissue injury just down the road in Philadelphia has been really hampering A.J. Brown, their big wide receiver. It's been about 3 weeks with the hamstring. How long and how troublesome can hamstrings be? Because it's such a big muscle.
Well, think about it. It's an explosive muscle.
Mm-hmm.
It's the muscle that you got to be able to cut and jump and run. And ultimately, depending upon if you have any fibrous tears, so a first degree, second degree, third degree, is the time length that it could take. If it's a simple first degree, some tightness, good flexibility, good strength, you could be back within 3 weeks. But if you're bordering that you actually had some tearing and some bleeding, that could take a little bit longer. Right. I mean, the other problem you have, too, is you got to make sure your athletes, especially with hamstrings, are hydrating appropriately, eating appropriately. Everybody discounts that. You got to realize the body is a machine, and It's got to be fed appropriately.
Tell me about the size of an athlete, because A.J. Brown's a big dude. I mean, he's 220-something pounds as a wide receiver. That probably aids or hampers, I would say, his recovery time.
Well, there's a component of length of the muscle, and as you know, as someone that's trained your whole life, is there's an eccentric load component. And when you put more weight, you have more issues. But I think that the Eagles staff and their physicians down there are going to do a great job in really making sure he's healthy before he comes back. But again, we're sitting here saying to ourselves that he's out, and they're probably doing it the right way. I mean, look at how many athletes you bring back too quick.
Right.
And then they're out for the rest of the season, and nobody wants to do that this time of the year.
Another Brown, who's a wide receiver, even though he's a lot smaller, is Hollywood Brown, who's been out with a broken clavicle. My brother broke his clavicle collarbone when he was in high school, and it put him out for the rest of the season. They're tricky because it's such a small bone. How do you treat and manage clavicle injuries?
So, if it's non-displaced, they can try and see if it'll heal down. But it seems like it's not healing down, and you have to put a rod in it. And over time, it's going to take about 4 to 6 weeks for that to really set in. And then, ultimately, the really good thing is it's a bone that you're not going to lose a lot of function. There'll be a little bit of pain. But once it's pinned, he's going to rock and roll pretty well once he gets out of that post-operative component.
Another injury that we hear often about, it's affecting Jonathan Taylor, who the running back for the Indianapolis Colts. It's called a high ankle sprain, which is really a ligament sprain. How long do these take? It seems like sometimes it puts guys down for a long time.
So what most people don't realize, it's a ligament that sits in between the tibia and fibula. And think about it, every time you weight bear and the mortise of the ankle sits in there, you're opening that space. And think about if you got to run, jump, cut. That's constantly opening and increasing inflammation. And the pain there it becomes intolerable, especially when a running athlete. So it's very, very important to decrease the inflammation, make sure you're getting good range of motion. But the most important thing is that really needs to heal down. Different than a lateral sprain where you can kind of use tape to really monitor it and control it. You've got to really focus. This is constantly weight-bearing, opening up and separating the tib and fibula. So you've got to really focus on getting that athlete healthy enough before you put him back. Because that can plague them for the whole season.
And it's complicated because it's your ankle. You can't be on it if you're trying to stay in shape. You got to do a lot of pool workout, I'm assuming. Like, how do you stay fit when you can't be on your legs.
So the biggest thing that a lot of teams do nowadays is, as you said, pull workouts, upper body ergometers, cycling. They'll do a tremendous amount of things to take them off weight bearing and get them to keep their aerobic conditioning and their strength up. So very, very important to do all of that. The other thing that's important too, and most of our listeners should know, the more you move and get your heart rate up, the less inflammation you're going to have in the area, which is going to promote healing. So that's all good.
Yeah. Let's get to a couple quarterbacks to wrap up. One is Taysom Hill, who's kind of that hybrid do-everything player for the New Orleans Saints. He originally had a lung issue that kept him out for a little bit, but now he's got a rib issue. We don't know necessarily if it's a fracture or not. Probably it is. But talk about those two injuries and how damaging and difficult they're to come back from.
Well, as someone that's had a broken rib, punctured lung through my wrestling career many moons ago, you know, the lung tissue will heal like any soft tissue in the body, of course, making sure that the rib's not in it, especially if it's displaced. But if there's no surgical intervention, a fractured rib is going to take 6 to 8 weeks to heal. And based on the position of a quarterback, I mean, think about it. You've got to rotate. You've got to throw. You've got to be able to do all these movements. And that rotation is constantly. The cartilage in between the ribs is going to take time to heal down. The scar tissue is going to take time. So, unfortunately, rib injuries take time. It's not like a lineman. You throw a flak jacket on him and he's just sitting there. You know, this is someone who's got to rotate, run, and cut. And it doesn't come. Now, as far as the lung is concerned, I'm sure they've got their pulmonologists involved, and they're going to make sure that his lung capacity is in full throttle before he's back on the field.
Derek Carr on Monday Night Football hurt his oblique. Oblique is a word that we hear a lot with baseball players recently, and it puts them out, puts them on the 15-day IL or however long it takes. Tell us about the oblique and why, for a quarterback in particular, it can be very troublesome.
Well, your oblique abdominal muscles, the side muscles of your abdomen, are very important in balance, stability, rotation. Think about a quarterback when he's got to unload that ball, step back, rotate, and fire. If you've got a strain in there and that's constant, that could be really, really painful. Again, the training staff is going to have to take their time with this. They're going to have to get great feedback from Derek. Derek's going to have to be communicating with the team, letting them know how they're feeling. This could be 2 weeks, could be 3 weeks, depends on how fast they rush him back. But also realize, again, we don't know how far is it. Is it torn or is it just a strain? If it's a strain, we'll see him back sooner than later. If it's a tear, this can plague him the whole season, and they're going to have to manage it.
Yeah, it's tough when you lose quarterbacks. John, I appreciate you once again joining us. All the injuries going on in the National Football League. We appreciate your sage advice.
Thank you. Greatly appreciate the opportunity.